Is there a hierarchy of symptoms in this? Do they always come in a particular order? Are some more prevalent than others or more severe than others? We heard Karen talking about paraesthesia in the hands and the legs. Could that be the only symptom, or?
Some people may have, a handful of symptoms. And paraesthesia, ataxic gait, a pallor, anaemia, certain classic symptoms of pernicious anemia may be what the doctor recognises. But if, like Karen, you're presenting with mental health symptoms, as alongside other symptoms that are physical, they often will push that patient down the mental health route, unfortunately. And it's really hard to kind of shake that tag off, and the patient can be pigeonholed. So for most people, oftentimes, should I say, fatigue is a major symptom, brain fog or depression.
And that brain fog perhaps could be put down to all sorts of things, couldn't it?
Yeah.
Including long COVID or other drug treatments.
I think, oftentimes patients are kind of pushed away by saying, oh, it's because you're a young mum. Oh, it's because you've got teenage children. Oh, it's because you're going through the menopause. It's because you've got elderly parents. It's because you've got a stressful job. And oftentimes patients aren't listened to and are dismissed because the doctor sees it as something at their time of life, instead of it actually being a physical lack of a vitamin.
So is it a possible cause of what could be diagnosed as postnatal depression?
Absolutely. So the nitrous oxide that's used during labour, if you have an undiagnosed mum who's given gas and air, then that completely inactivates the B12. So mum may go off and end up with postnatal depression if it's not tested for. And then the baby, if the baby's breastfed, they're not able to access any B12 because mum's B12 has been totally inactivated by the gas and air. And you see kids obviously using these canisters with nitrous oxide recreationally, and that's causing serious problems, neurological problems in them too. Yes.
All of that is so relevant to what we as primary care practitioners do, even though we're unlikely to be the first port of call for someone with a mental health problem, perceived to have that sort of problem, or depression, ataxia or muscle pains or paraesthesia, things like that, or even just general malaise. People might well come to us for that sort of thing, so it's worth us knowing about this.